Good morning and welcome to the Mayor's Weekly, our first segment in calendar year 2021. We're pleased to be with you. I say good morning. It's good in many ways. It's bad in many ways. Unrest in our country. COVID is rampant, and that's what we want to talk about this morning. Kathy Shamus has joined me, but we started talking about COVID in this city in March of 2020 when it began to spread to the United States and spread into Alabama. And thinking that we would be hit hard in the early days, and that did not happen, but it has arrived. It has arrived with a major force. Our employee ranks, which total about 200, are being hit hard by the COVID. Probably April of 2020, our leadership sat down and we formulated a plan that made some assumptions about how our workforce might be affected by the COVID virus and how we would operate the city if such were to materialize. Well, and I commend our leadership team to keeping the plan that we developed on the forefront, not putting it away to collect dust. And I can tell you today, we're executing the plan that we developed. It's working. It was a great piece of work that our leadership team did almost a year ago. The frequency of positive tests in our ranks has grown by leaps and bounds, which Ms. Shamus can attest to. And while we have 200 people, and when you in a city the size of Jasper, an entity employing 200 people puts you up near the top. There's not a lot of, we don't have a human resource officer. Ms. Shamus doubles as the chief financial officer, human resource officer. Our payroll folks, they provide some services, whatever. But we have quite a few positions across the city that you don't have bench strength. You only have one of them. Thank goodness for some cross training and that sort of thing. It's allowing us to carry on the execution of this plan. I spoke with our assistant police chief yesterday. He's working now. Our police department's been hit hard to have the correct staffing to look after our city in the coming days, and so having that plan. Now, without the plan, we'd probably just be wandering around aimlessly trying to figure out, wringing our hands, what we can do. But to have that plan that was well constructed and execute that plan, we're going to manage through this. But we've seen folks right here in this room come in and display an indifference to the COVID virus. What I tell folks, if you have a person that does not care about their life, then certainly they don't care about the lives of others. I was in a big box store yesterday afternoon, Ms. Shamus, and I saw what appeared to be a parent and children and others with no mask on, that sort of thing. Just absolutely appalling that you would think selfishness would kick in. Hey, I'm going to look after me, and when you look after me, then I'm looking after you and the people around me.
Exactly.
It's just beyond my understanding. But there's nothing I don't think we can do about that, and so we move on. We encourage. In the last 5 days, I've lost 2 friends to the COVID virus, and I want to give you a couple of examples of just how bad it is. I'm not talking about Washington, D.C. I'm talking about 35 miles east of here, Birmingham, Alabama. We're all familiar with UAB Hospital, one of the best in the country. at this very moment, they are caring for cancer patients in hotel rooms because the beds are taken up by COVID patients. Now, elected officials, mayors all over this state have it. I'm pleased to report I don't, and my commitment is to not have it. But our mayor just down the road, Mayor Woodfin, Mayor of Birmingham, was diagnosed and he was released from the hospital yesterday. And here's what Mayor Woodfin said. It couldn't be said better. As a patient, and let me say this, if you question the authenticity of what I'm sharing with you, this is coming from AL.com. Look at it yourself and you'll see the same thing I'm reading. But here's what Mayor Woodfin said. As a patient, as a citizen, and as a mayor, if there was a time for people to continue to take steps to help stop the spread of this virus, this is the time. Woodfin said, we are not out of the woods. People need to take this virus seriously. Mayor Woodfin, and you read through it, Mayor Woodfin is pleased to be alive. He developed pneumonia, and had he not stayed in contact, you can read about that, with his primary care physician, getting to the hospital early, then Mayor Woodfin's life could have very well been in jeopardy. So, what do we do in running this city? I was optimistic that we could start moving on some things in the early part of the new year. I think today what we have to do with how the COVID virus is a time that we have to slow down, begin to take baby steps, and make sure that we have done what we need to do to counter the spread of the virus, that we have a healthy workforce before we really take on things. And we will. It will get better, I think. The vaccine's coming. We're working, I think maybe today, our firemen will get their vaccination. It's not mandatory, but the ones that will. I worked with our police department yesterday, and I think probably next week through the state health department that our police department will have an opportunity to take the COVID vaccine. What sort of participation we get, I don't know. You can't make it mandatory, and rightfully so. People have some concerns about side effects, that sort of thing. But we're moving in the right direction. But I think what we do in running our city today is, I said, we slow down, we take baby steps, look after our people, manage as closely to the best as we can, and then when things get better, we go. Now, over the last 4 years, we've worked diligently. Ms. Shamlis has been a part of this to make Jasper City a better place to work. Benefits, pay raises, that sort of thing. We've done that. We've made significant improvements in those areas, and I think it's reflected in the morale of our people. With the advent of COVID, and is everybody across the country, whether you're in the private sector, the public sector, scrambling, what do you do? I had a discussion with one of our employees this morning about policies and that sort of thing. The employee brought some very valid points. But we have tried to do what we think is in the best interest of our employees as an accommodation to them, to support them if they're diagnosed with the COVID virus. And I've asked Ms. Shamlis to, and we could spend 2 or 3 hours probably talking about this, but in a very, very simple way, share with you the provisions that have been made for our employees if they contract the COVID virus. Ms. Shamlis, if you don't mind, share that with the people.
Yes, sir. You know, we're now beginning to see cases really in almost all departments, including here at City Hall. So it's hitting home to us. And one of the first things that we have done is we've decided that in our building here, we're all going to wear masks. This is to protect us as well as the people that we come in contact with, and we also ask that people coming in our building wear masks. We've also tried to do more separation as it relates to our employees that are having to or do offer services with the public, such as in our business license department. At the present time, to protect the public as well as our employees, we're unable to do face-to-face license renewals. We will ask the council to extend the time to get business license renewed, but this is one of the things that we're just going to have to do right now because of the uptick in the number of COVID cases. Well, of course, we do all the spraying with disinfectants to try to keep this facility as absolutely free of the virus as we possibly can. We are, anytime any of our employees feel that perhaps they don't feel well or they maybe just have a little bit of a runny nose, we send them to be tested. And one thing, Mayor, that I think that I see, and our employees don't want to make anyone sick. They're very conscious about the other employees that they're working with. So, you know, we're doing as much as we possibly can and still keep this facility open. And, you know, we will continue to do that as long as we can. If our cases continue to increase, we will have to shut our facility down to the public. But at the present time, I think with the safeguards that we have in place, you know, we're just hopeful that our staff will remain healthy and we're able to continue to remain open and provide services.
What do we do going forward? I can remember very vividly because I took the heat about our park and rec activities and why we were not doing those things, whatever. I received numerous comments praising our taking a conservative approach to that. It's proven to be, and that's not saying we're right, but it's proven to have been the right decision. And what does the future hold there? I don't know. If you call me, ask me, I don't know. I think we do it day by day. Now, Ms. Shannon, it's one thing that we have done that if a person that works for this city contracts COVID, we've made a provision for them to convalesce and not have their payday impacted.
That's right.
That sort of thing. Could you give a little overview of that?
We have, the council provided 80 hours pay to employees to be used to while they may be off with COVID-19 or while we may have them off waiting test results. So I think that's been a huge help to our employees. I feel like the council, some of that provision may have died in December 31st, but I do think our council will extend that benefit on into however long that we continue to see these increases in cases.
Yeah. Our position here at City Hall, the position this mayor is going to take, is a rigid position that you ought to follow. The safeguards that have been rolled out to us, not going to be timid about that, not going to be intimidated by anybody about this position, because people are dying every day, and if you elect not to look after yourself, that's your call. But the extent that we can, whatever, we're going to try to ensure a safe environment for our employees. We're going to support our employees if they contract the COVID, and we're going to run our city in the best interest of the taxpayers of this city, and that's just where we're at. And so any comments, anything that wants to rebut what's said this morning, I welcome your call. I welcome your questions here, and we'll be busy about responding to your questions. But like I said, I continue to be appalled by how many people appear to be oblivious to what's going on out there. People are dying, but I can't change that. All I can do is lead by example, and that's what we're going to do. So thank you for being with us this morning, and we'll look forward to being with you next week.